Hey everyone, it's Marian from the New York City Organization of Public Service Retirees. I came across two videos sent to me, as well as another group of videos that I had to do some research on to understand exactly what was being given to me. So there's a whole theory with Medicare and Medicare Advantage, and some people understand it and some people don't. And it has to do with payments. Why would a broker want to sell you a Medicare Advantage plan over a supplemental plan to traditional Medicare? Well, there's a reason, and it's money driven. And the theory is, no, that's not true. Well, it is. According to the rules that we have found, that there's like maximum payments for Medicare Advantage that should be about $600 a year for a new enrollee, for a salesperson to sell a plan that's Medicare Advantage. However, what they're doing is using all of these extra fees on top of it to boost that to well over $1,300. And in the process of being able to do that, screwing senior citizens and the disabled off of their Medicare, putting them on plans that don't work for them or that they shouldn't be on. And then, of course, then it's too late. So when I got these videos, I want to show them to you because it's disturbing. And it was actually set up as a seminar to, I guess, train and teach people. And there's some sales representatives and I think a Blue Cross Blue Shield representative. And so I want to show you the videos and then explain it and then show you exactly what our own government is doing about it, what CMS is doing about it, and what you can do about it. So this will probably be about a 15-20 minute video, and I'm going to make it as tight as I possibly can. Okay, so this is the first video that was sent to me, and I'm going to share this with you.
Tuesday, Wednesday of next week, I'll do 5 events, and from 5 events on average, I get about 125 people that show up. From those 125 people, I get 120 of them that say, yes, I would love an appointment. So yeah. if that's the reason to do it,
it's pretty high, especially seminars.
Yeah.
That's been
and the piggyback before I pass it on to someone else because I talk too much. This is where the carrier rep can really horsepower you because that's all the stuff she just said she can sponsor. Yeah. Right. If you're really creative, you secretly talk to 2 carrier reps, and you can get the 2 of them to pay 50% each, and then you don't pay anything at all. And then you talk to your upline, and they co-op at 2, and now you have 3 times the money.
And we're okay with that. Yes.
Absolutely.
Isn't that pretty greedy? And if you didn't notice, the lady at the top, her last name is Trevino. The lady in the bottom, her name is Trevino. I think that's what he's talking about when he's saying possibly that you talk to 2 reps quietly. But this is one of those things. And this is really an ugly thing in that the way he's talking about that representatives from these different companies will end up making these enticements to a representative into selling these plans and giving them more money to do so. Now I want to share with you the next video from the same meeting.
Competing with agencies that have hundreds, if not thousands of agents, and I've got 30. And so you got to be realistic when you go into it. But yeah, the carrier relationships for me, not only for the opportunity, but on the backside of business, to me, is where the carrier relationship pays off the most. So if I'm having a problem with XYZ client, they can't get a drug approved, they can't get a surgery approved or something like that, that's where my relationships pay off, more so than any lead or anything else that I get is on the retention side.
And see, and that's another issue, is because you shouldn't have to go back to the person that sold you a plan to get something approved. We don't have to do that in traditional Medicare. And if you do, there's an appeal process that goes through that plan, but very few instances does that happen. That is because Medicare does not come in between you and your doctor, whereas these insurance people, their plans that they are representing or trying to sell you absolutely does. So now I want to bring you to Medicare. So this is a CMS.gov document that came out in the beginning of November about the Biden-Harris administration proposing to protect people with Medicare Advantage and prescription drug coverage from predatory marketing. And this was a whole study that was done a hearing that was also done, and I want to share a little part of it with you because this was a very long video, it was a very long hearing, but I want to try to share little parts of these with you. There's several different people, organizations that do this, and healthcare advocates and insurance advocates, but I want to share just a small portion so that you understand exactly what they're talking about and take it from the perspective of an insurance company. Whereas these are small mom and pop companies that are trying to make a living, and then this is what they're dealing with, is these predatory type of insurance people that are having money thrown at them from these large behemoth insurance companies to push their product on people, Medicare Advantage, and what it does in general. So I want to go to the Senate hearing video.
Hoagland.
Chairman Wyden, Ranking Member Crapo, and members of the committee. My name is Krista Hoagland, and I'm the Chief Executive Officer for Security Health Plan, a provider-aligned plan that is part of the Marshfield Clinic Health System. It is my honor to be here today to discuss this important topic of protecting Medicare beneficiaries. Prior to my current role, I served as the Chief Financial Officer and Chief Actuary at Security, with nearly 20 years of actuarial experience, including working on MA bids. And on a personal note, I am familiar with the consumer side as well, as both of my parents are Security MA enrollees. Today, I'm here to share our experience about competition and marketing practices in the Medicare Advantage market. Security Health Plan has offered MA for 2+ decades, proudly serving more than 60,000 beneficiaries today. In the most recent open enrollment period, 2/3 of national enrollment went to just 2 large national for-profit companies. We very much appreciate the attention this committee and CMS have paid to the issue of inappropriate marketing aimed at seniors, but more must be done. While consumers get information from many sources when choosing a Medicare Advantage plan, the single most influential perspective does remain brokers. We value the important role brokers play in efforts to educate our consumers, sell our products, and support our members. Local brokers are a trusted partner for Security Health Plan and health plans across the country. In fact, 85% of our MA enrollment at Security Health Plan comes from our more than 500 brokers that we are very proud to partner with. Unfortunately, we know some large firms and third-party marketing organizations leverage their influence for financial gain rather than what's in the best interest of the consumer.
Like the ones I just showed you.
Many of these field marketing organizations receive add-on or incentive payments that go above and beyond the CMS-approved broker commission caps. Instead of collecting the maximum commission of $611 for a new enrollee, many brokers are collecting $1,300 or more. This additional compensation is marked as marketing, administrative dollars, and can include all kinds of additional add-on fees besides that. This creates an environment in which beneficiaries and ultimately the Medicare program itself are paying out billions in unnecessary dollars. These aggressive marketing techniques have real-world consequences. Just last week, in a conversation with one of our trusted broker partners, he described the ambush that had already begun ahead of open enrollment, which is technically not allowed, with his clients receiving as many as 5 or more phone calls a day. And his team is barely able to keep up with their existing customers, answering their questions, making sure they understand what those calls are about, let alone seek to support new enrollees that might be interested in enrolling in MA. In a previous Medicare open enrollment period, our team assisted a senior who was tricked into enrolling in another plan. We worked with the consumer to re-enroll in the Security Health Plan product, not once, but 4 times in a single open enrollment period. These aggressive tactics make it more difficult for smaller regional health plans like Security Health Plan to compete. Less competition between MA plans means less pressure to keep costs low and less innovation. This is a disservice to beneficiaries and taxpayers. I urge you to engage with CMS to review the practice of add-on broker payments to ensure that unfair practices are inhibited, especially total payments above and beyond the CMS caps. Further, CMS and regulators must remain vigilant in enforcing marketing rules that protect seniors from misleading and aggressive marketing. I thank you for the time this morning and welcome the opportunity to answer questions.
Thank you all very much. And this, of course, arrives at such a crucial time, the start of the open enrollment season. Let me start with you, Ms. Hoagland. You gave us an example of what amounts to a jaw-dropping ripoff. You basically said that some of these plans are paying $1,300 or more for a new enrollee. Is it right that when you add all of these extra costs, all of the costs heaped onto the system by these middlemen, this comes to somewhere in the vicinity of $6 billion?
Yeah, I would say that that estimate might even be low. I mean, truly, I think it's really important that we're recognizing the amount of dollars that we're talking about here. They are quite significant at the benefits of perhaps, lower costs for taxpayers or additional benefits for enrollees. So as I said, that maximum commission of $611 per new enrollee, but we're continuing to see this growing trend in paying these field marketing organizations, these middlemen, as you call them, all kinds of additional fees. You can call technology fees, referral bonuses, marketing, health risk assessment, and on and on and on. The list of creative add-ons continues to grow. And so this has really become sort of an arms race and creating this anti-competitive environment where, to my colleague's point here, that folks aren't necessarily being enrolled in the plan that's right for them. They're being enrolled in the plan where the incentive lies. That's the largest.
And the reality is we want competition in the system based on coverage. The way we stop the ripoffs in traditional Medicare, and I mentioned, when I was director of the Gray Panthers, I'd go to a senior's
Medicare Advantage,
house,
not traditional.
and they'd
Medicare.
go to the back room and be kind of embarrassed and bring out 10, 15 policies that weren't worth the paper they were written on. They had these fancy subrogation clauses, and you basically got nothing. The way we drained that swamp is we had some core standardized principles around which traditional Medicare is offered. There's competition, but it's competition based on coverage, not who can win the arms race. Is that
Right.
really what you're recommending here?
Yeah, absolutely. We want what you want, which is, sort of fair and equal competition. But competition ultimately is what is best for our seniors and making decisions based on the benefits offered, right? Not the financial incentives.
So you characterized it as an arms race. Paint the picture of what would happen if nothing is done. Supposing the Congress just says, we're very busy, we don't have time to deal with it, and they're making a good point over there in finance, but we got a lot of stuff on our plate. I share your view. I think there will literally be a healthcare arms race, but paint the picture of what that would look like.
Yeah, I mean, I think the first thing is we would continue to see add-on payments. As I mentioned, there already is a lot of creativity about what these things can be called, and I think we continue to see that number grow and grow if there's no caps or additional transparency. And then ultimately that starts to inhibit competition as smaller regional plans in particular are not able to afford to keep up in that arms race and continue to make these add-on payments. And so I think that ultimately it does lead to less competition and not things that are in the best interest of the beneficiaries.
So what I want to add to you here, to this point here, is this has happened in New York State. Similarly, in another situation, we've been advocating to protect retirees, that retirees should have access or choice of plans, that they should not be forced into Medicare Advantage plans because we've always had choice. Medicare Advantage was always meant as an option. It wasn't meant to be forced on you. But what happens is these large insurance companies, your Aetnas, your Anthem Elevances, your Humanas, your United Healthcares, your Cignas, are gone around the country. And they're approaching companies and they're encouraging them to force all of their retirees into a Medicare Advantage plan, eliminating all other competition and only using their plan, stripping all choice for a retiree and eliminating the choice to stay in traditional Medicare. That way, they offer the plan at no cost to the former employer or the former union and take all of those retirees and force them into their Medicare Advantage plan. One plan. And they give it at a $0 premium or a low premium to the company. Now, we've only seen them at a $0 premium. I hear the one that we're talking about next is Cortland County, which they were still going to charge the county for. But that cost was being passed on to the employee or the retiree, actually. That said, the contracts were very telling, and I want to show it to you to show you what kind of money was involved in this, in addition to all the money you just heard from this young lady talking about that is being made between the insurance company and the broker. In this situation, this company is Assured Partners. Assured Partners was hired as a consultant answering an RFP to Cortland County, New York's labor office in trying to sell a healthcare plan to their retired workers. So they approached the county to sell them a Medicare Advantage plan to get the retirees off the traditional Medicare plan that they were on and put them on a United Healthcare Medicare Advantage plan. Now, that contract is this. Assured Partners, Premier Consulting, scope of prices, services and pricing. So what they were going to provide them was a Medicare Advantage plan. They talk about their services, their communications. They weren't even including in this process like the printing and the mailing. That was all extra costs, right? Scroll down somewhere, I think it was page 4. Pricing. They were going to be getting a annual consulting fee of $90,000 for the terms of the contract from 23 to 27. Now, in addition, they had other costs that would be added in that wasn't included in that if they wanted to add, the county wanted to add in, that some were included, some would not be. Now, this group Medicare Advantage plan, standard carrier commissions or a comparable monthly fee. Now, this does not say that they're not going to get that. It could be that they are, maybe they're not, but this isn't exactly that clear on that. But that is not included, meaning that I'm sure that United Healthcare was going to be paying this broker a lot of money to be selling this plan to all of the retirees in that one county. Then, in addition, they were going to be making 35% of audit savings, whatever that they would save the county for forcing their retirees into a Medicare Advantage plan, they were now going to make on top of that. Now, this broker who was selling this insurance plan, potentially getting a commission from the insurance company, making a $90,000 fee on an annual basis, plus 35% of whatever savings the county realized by doing this. Do they have an incentive to push this plan? They absolutely did. Is the United Healthcare plan just like every other plan that's Medicare Advantage with networks and prior authorizations? Yes, it does. Does every doctor in the United States of America accept United Healthcare? No, even with out-of-network benefits. So, in wrapping this up, it's very easy to say to you that Medicare Advantage brokers, not all of them, some of them, a large portion of them, especially when they're pushing a plan from a behemoth insurance company who's throwing billions of dollars of marketing money and fees to them to encourage them to push their plan. As you heard in the first 2 videos, sell their plans. They're more apt to push a plan that will enrich their own bottom line than one that's good for you. And as you heard that young lady say, they had to disenroll one customer multiple times from a Medicare Advantage plan during a single open enrollment season because of how many times that this vulnerable population, this vulnerable person, was lured into a Medicare Advantage. Let's hope and pray that we can turn the tide on this. In the description of this video, please look below. I am going to put a link to CMS for you to comment to Medicare on how you feel about this process and how you should be putting in your 2 cents about how you think they should be paid, and that it should be equitable and it should be transparent. And there are all of these fees of taxpayer dollars, by the way, because this is coming from Medicare, going to these insurance companies, from these insurance companies to these brokers to push Medicare Advantage. It should be equal, whether they sell a Medigap or they sell a Medicare Advantage plan. The commission should be the same. They're doing the same job. It just shouldn't matter which plan they're pushing. Anyway, have a great night, everybody. Be safe out there. Open enrollment's almost over.